It's an apple. Okay, that's the best one I've seen so far. The fact that he's coming. Hey guys, Dr. Sil here, junior doctor from Sydney, Australia, and I felt like a laugh, so let's go through some memes. Let's go. So I've already seen the first one because it opened up, but Psycho the Rapist. This is a good tip for me who wants to be a psychiatrist. Because if you're a psychotherapist, that's not a mistake you want to make. If you connect the measles, it spells out my parents are idiots. Oh, look. This is a tricky one. I don't want to use shame to make people who are anti-vaccination, I don't want to use shame to change their mind. Measles is a very contagious illness. It's, you know, if in an unvaccinated room of kids, if one person gets measles, the whole room gets measles. And vaccination in general is so well evidence-based and absolutely important, and it has helped eradicate illnesses. Nothing else has ever come close to achieving that kind of a result, to eradicating illnesses. So, yep, very pro-vaccination on this channel. Any doctor here? I'm a doctor, what's going on? A heart attack. I'm a doctor in philosophy. He's going to die. We're all going to die. Oh, yep. I feel like this joke is also made against psychiatrists. He's going to die. Well, do you want to talk about it? You know, like, let's do some psychotherapy. Performs life-saving 12-hour surgery. Seems pretty proud. Patient thanks God. Yep, see this all the time. Who are we? Doctors! Yeah. Yeah, look, look, I'm going to be honest with you guys, I've had things returned to me because of my illegible handwriting. I'm very sorry about it. I try not to be, I don't purposely try and have messy handwriting, but when you got stuff to do, you're going to write quickly, and I write maybe a bit too quickly. But it's messy, but it's also very quick. So I think overall, even though I've had to rewrite a few things, I've saved times by writing messily because it's so much quicker. Australia versus US language differences. Bloke, man. Cyclone, hurricane. Lift, elevator. Shopping center, shopping mall. Universal healthcare, blank. Gosh, what an easy shot. Yeah, look, in the States, universal healthcare is associated, it's attributed with jobs. So when you have a good solid job, you get healthcare covered off, which is a bit of a problem when people don't have jobs. But often, you know, there's a lot of reluctance to go for universal healthcare because of the costs associated with it. I think the evidence is in my opinion, that it costs a lot less to have a publicly funded universal healthcare rather than to just have all these people not covered, and then when they do go for the necessary procedures, it's later, in their life, they present later, more sick, and you know, often they die because they didn't present earlier. So it's a devastating thing. I'm very pro universal healthcare. I hope that's not offensive to anyone, but that is my opinion. Kid, are you going to save me? Doctor, well, I could heal you quite easily by giving you medication, but your parents think all you need is prayers to get better, so you're going to die, LMAO. Oh, come on, that's a bit of a... Look, it's nice when people pray for their kids and stuff, but I guess not when it comes into contradiction with evidence-based medicine. You can use your prayers in addition to evidence-based medicine and therapies. Police, medic. He will beat you to health with this magic wellness stick. Oh my gosh. Yeah, what the hell? That shouldn't be, oh, that's a confusing photo. I didn't know that they could do that. I didn't even know police medics were a thing, to be honest, but I guess if you're in a riot squad, Jesus. Doctors, are the results of my test ready? I'm dying from curiosity. Not only from curiosity. Oh my gosh, look at, that's just that photo. And I love how there's a red tint to it. Oh gosh. Medical students watching surgery for the first time. Yep. Totally. Although the one inaccurate thing with this is the lights aren't on. But yeah, that's pretty funny. So, tell me everything you told the nurse 5 minutes ago. I piss off a lot of patients with this one. You know, like they don't want to repeat the story 1,000 times, but you have to as a patient. It's the most common thing you'll do in a hospital because you have lots of different teams taking care of you. The ED, the surgical, the trauma, blah, blah, blah. And you have to repeat your story for each of them. Prof, can you show DNA and RNA visually? Oh, wow. Daenerys. This is a bit of an old meme, but yeah, no, so RNA is a single-stranded nucleotide structure, and DNA is double-stranded, and DNA transcribes into RNA, which then translates into proteins, which is how you create things in the body. So there you go. DNA left becomes right. Number 14, thank you for getting here so fast, doctor. Not a problem, Linda. I'd hiss. Oh, it's an apple. Okay, that's the best one I've seen so far. The fact that he's coming. Yeah, okay. I did not get that at first, but yeah, that's hilarious. Yeah, an apple a day keeps the doctor away. Your x-ray showed a broken rib, but we fixed it with Photoshop. Okay. When a patient doesn't want to cooperate with any of the medication and treatment, here's a coffin. Look, this is a difficult circumstance. You know, patients have their own values and sometimes therapies conflict with their values, and you have to kind of meet halfway and respect people's autonomy to make their own decisions, but also at the same time, do your duty of care so that they understand the consequences of their decisions. I've had a situation where a patient refused a cannula to have medicine that could help him with something that was pretty acutely wrong, and he could have gotten really sick and had heart problems. But he refused it to me, and so I just said, that's okay, you have capacity and insight, and let me just explain the consequences. And I explained the consequences, which was risk of death, and he accepted that, and I respected that. And obviously I have to escalate that to my senior doctors, and if they want to have the conversation with the patient as well, they'll do that. So just respecting people's wishes, you know? Doctor, what brings you here today? My car, haha. Okay, writing in chart, not sexually active. I guess it's because it's such a bad joke that that's what you can write. Okay. When a nurse takes up gardening. Oh, look at all those IV poles. I love it. Quick Charles is losing a lot of blood. He needs an infusion. What's his blood type? B positive. I'm trying, but he's losing a lot of blood. Yeah, go on. All right, I'm going to use this because I'm in trauma surgery where we use a lot of blood. So next time someone says B positive, I'll say I'm trying to. All right, want the good news or the bad news first? Good news, please, doctor. Well, they're naming a disease after you. Oh my gosh. Yeah, you know that whatever you have is not a good illness when all the consultants want to come review your illness. And if they name a disease after you, then that's a rare finding. I wasn't hurt that badly. The doctor said all my bleeding was internal. That's where the blood's supposed to be. Yeah, that's it. No, there are spots where blood is meant to be and spots where blood is not meant to be. And so in trauma surgery, you know, as a trauma surgeon, the most common way that our patients get really sick and even die is by blood loss. And the expression is blood on the floor and 4 more. And so these are the areas where people can lose blood. Now, blood on the floor, you know, at the trauma event, you get hit by a car and you're bleeding onto the road, that's blood on the floor. But there's 4 more places you can lose incredible amounts of blood and you might not know it. So the first one is around the lungs, okay, in the thorax. Second one is around the intestines. The third one is in the pelvic area. And the fourth one is, can you think of it? Bones. So bones are super vascular, and if you break your femur, you can lose up to 2 liters of blood, okay? Huge amounts of blood. You only have like 4 to 5 liters of blood in you, so you could lose like almost half your blood volume in a really badly broken bone, and that would almost certainly make you really sick or even die. So blood has very specific spots to be in the human body. You need to take one of these pills every day for the rest of your life, but there's only 3 pills, doctor. Exactly. Oh. Oh, that's so sad. I don't know if that's funny. Doc, it hurts when I touch my shoulder. Then don't touch it. That'll be $60. Oh, yeah. Oh, every nurse's dream. So true. Oh my, okay, that is, I don't know if that's real or not. That's a bit ridiculous. That is ridiculous. But essentially, you could get a 1 gauge cannula into one of these things. When you say I need a 16 gauge or a 20 gauge cannula, the higher the number, the thinner the actual circumference of the needle. And so like in that vein, you could get an 8 gauge cannula. They don't exist because you never need them, but it's basically down to 14 gauge, which is like pretty, it's pretty thick, and you use them in resuscitation when you need to give someone like a liter of fluid in like 10 minutes kind of thing. Big bloody needles, but these veins would be easy. I can't feel my face when I'm with you. It's a stroke. You're having a stroke. Dr. House saying it how it is. If you can't feel both sides of your face, it's not a stroke. Usually not a stroke. If you can't feel one side of your face, you call for help quickly. You probably call for help for both of those situations, to be fair, but I don't know what would cause bilateral decreased sensation. Something pretty bad, probably. And then I said, the doctors will be with you in a minute. And the nurses are laughing. Oh, so true. Look, we try. You know, I get asked by the nurses, can you come see this patient as soon as you can? And sometimes I have to say, look, I'm really busy with sick patients. Can you give me the mobile number and I'll call them when I have a second, if they have to leave or whatever. So we try and make it work. All right, guys, that's everything for this video. I hope hope you enjoyed it. I just felt like a bit of a laugh. I hope you guys got a giggle out of it as well. I wish you all an absolutely lovely day, and I will see you all in the next video. All right? If you enjoyed it, by the way, consider leaving the video a like. You can subscribe to my channel. You can join me on Patreon, which, by the way, first 25 people on Patreon will get a phone call with me. If that's exciting, I don't know. And look, yeah, I wish you all an absolutely lovely day. Bye for now.